So what are the causes and what is sciatica? Sciatica is inflammation of the sciatic nerve. And as it presents, what happens many times, it's the largest nerve in the body, and that's how most people know it. And it travels from the lumbar plexus all the way to the leg. So anywhere that thing is touched, it's going to radiate pain. Now, what are the causes? Well, they could be from vascular, they could be from compressive, they could be from lymphatic. There could be a space-occupying lesion, such as a tumor, causing the issues. Now, a good clinician will do a lot of different tests and a lot of different assessments in order to determine where it is having the problem. So when I have a patient, they come in, and the first thing is we have to do is a history. We have to assess and we have to find out what's going on. So finding the history of something that all of a sudden someone starts sitting or they become active or they get hit in the back and they start having sciatica, it really bodes to a well dynamics. Picture on me this way. So what happens is what we need to do is we need to discuss the dynamics of where it begins and what goes on. So in terms of our direction, I would like to first take you to the physical assessment. When you explain to your doctor what's going on, you need to tell him exactly when you started having it. That's very important. The history is very, like, when are these issues? Do you have a sedentary life? So these are the types of issues that present. Most of the time, a person comes into the office with having a severe presentation that they're really shocked. They didn't expect this. And what occurs is HDMI. So what occurs in this particular area is that you can actually see where the nerve root comes in. So over here, you got to figure out where it came from. Now, as you notice, a lot of the reasons that a lot of these individuals have it is because it's a little bit of atrophy and muscular issues that arise. As you can see right here, there's a lot of areas where the nerve can become entrapped. This is the main reason that most people have this issue. Now, as they go through this and they present a symptom, I got to figure out, and along with our team, we have to figure out where the problem actually originate from. So as I go through that, I want to also give you a different dynamics here. In what I'm going to explain, I'm going to present my team to you so that they're all going to, each one of them is going to explain a little different aspect of what goes on. Now, today we're going to be discussing how a coach, such as an individual helping the doctor, can assess the situation. We are going to talk to our coach, Kenna. We're going to talk to Astrid, who's going to bring some science knowledge here. And we're going to actually bring a patient in and discuss exactly what the experience was with her, and also bring in our top guy from the university at the biochemical level. He's going to teach us a little bit about some nutraceuticals and some applicational processes that we can do to help an individual with sciatica. So I'd first like to tell, I'd like to ask a question to Kenna. So Kenna,